all the distinguished members present here today. From us, the different partners led by Rotary, we are very honored to come to this event where we are handing over 50 garments to the regional referral and all the lower health units or health facilities within Ankole. And these garments are aimed at saving lives and reducing the maternal mortality death within the region, and which will count to reduction of the death within the country. So from us, we appreciate deeply the partnership that we've established. We appreciate deeply the relationships that we've built, and we pray and continue that on behalf of Rotary and on behalf of all the members and partners present here today, our efforts, our energies towards saving mothers, towards saving lives in this country will not only end today, but will continue to work together for the good of this country and for the good of all the Ugandans.
The Ankole local maternity and neonatal system. Yeah, so PPH or postpartum hemorrhage is bleeding during childbirth, and we talk about this when mother bleeds over 500 mils after the delivery process. And to note is that postpartum hemorrhage is quite a common condition, and every woman who is pregnant is definitely at increased risk of bleeding. They are at we note that the postpartum hemorrhage accounts for about 12% of the complications that happen during the delivery process. But we also need to note that postpartum hemorrhage in the country accounts for almost 36%. 1 out of 3 women of those who die during childbirth, some of these complications will die because of bleeding during the delivery process. That is the statistic for the country, and for Ankole we noted for the year 2023-2024 that postpartum hemorrhage accounted for almost half, almost 48% of those who died. The women who died during childbirth or complications during childbirth, postpartum hemorrhage was one of those that was implicated in this condition. We need to note that different measures can be taken, including medication, including offering some care, but we also need to note that some of these may not be available, and we note that this could be worsened by delays, which could be at different levels, at levels where patients delay to reach the hospital, patients or mothers delay to get care for one reason or another, or even when they are at areas of care, some of the equipment, some of the items that may be required, for example, the medications, blood, may not be readily available, and we may benefit from additional items or gadgets like the non-pneumatic anti-shock garments, which we typically call the Nazi. And the non-pneumatic anti-shock garment is a gadget that can be used to improve. It has been found and recommended by the World Health Organization to be able to improve the circulation of blood, especially for the vital organs, by pushing it from the lower organs like the legs that may not be vital at that time when the patient is actually bleeding, and save it for the heart, for the brain, as a way to prolong life of this patient, as we aim to get them reach to the area where they are able to get the care they most need. For example, where they may need an operation, where they may need some of the blood, or if we have to transport blood and make it reach to the patient, it would give time for the health worker or for this patient to be able to have enough blood to sustain them, as much as they have lost quite higher sums of blood. be able to sustain their life as additional interventions are being given for this patient.
Care. Of course, the intervention for today is really touching one of the spots here. We are seemingly noting a lot of delays, but we will see as we go more forward. So, how do
of the Rotary Club of Mbarara. Today we are at an official launch and handover of 50 pneumatic anti-shock garments. This idea was presented to us by our charter president, who is Rotarian Henry Makrogowe, who is currently the president of the Rotary Club of Cambridge, and had wanted to partner with us in order to deliver these garments. So we had a few talks at the beginning of the Rotary year. That was the first quarter, July to September, and we agreed to be able to give these to the Mbarara Referral Hospital. And now the Mbarara General Hospital was the first partner that we thought about, but then they also told us that the Medical Teams International would be willing to also support in this initiative. So it is not, most people might look at it as a small initiative, but it's going to be able to contain the hemorrhage that has been affecting women when they give birth. I think Dr. Levan has provided most of that information. So for us, we are coming in as donators, but most of the technical work is going to be done by the Mbarara General Referral Hospital and Medical Teams International. Women losing lives while giving birth as well has been something that has affected. Your lives have been lost amongst women when giving birth. It is something, mortality rates have always been an issue all over the country. So this coming up was because it was an issue that needed to be sorted. And considering we are a new club who could not have been able to raise a lot of money, so having a partner like RC Cambridge partnering with us, we'll be able to use the lowest item, let's call it lowest, probably low cost, to be able to save lives was something that we were willing to take part in.
To use effectively and protect it jealously. Thank you.
Different contacts that made this easy for us. So just to summarize, the process that started and intensified so much this year around March has seen this project succeed. The Rotary Club of Cambridge supported us with money totaling to about £3,500 and they are the main contributors to this. But of course that doesn't downplay what you have done, all of us. The other monies came from the Rotary Club of Mbarara, that is ourselves. The total cost for procurement of the garments alone, we spent an estimate of the procurement, the branding, the clearing. It was joint medical stores supported us to shipping. I mean, the shipping and the procurement was done by us. Of course, the main supplier was Global Health, like I said earlier on. So we had to ship this through joint medical stores. We had a bit of a challenge to explain to them as a Rotary Club. They were not understanding how are we talking about medical equipment. So we had to get to the team again, Dr. Levan, to give us a cover letter to really confirm to Uganda Revenue Authority that these are medical equipment. So thank you very much, because that was another big cost that we survived from there. So thank you to that team.
So the mother is stable, and so you have time to transport her, say if she has delivered in the village at home, from her home to the nearest health center. Or if she has delivered at a health center 2 or 3, or health center 4, and you have to take her to a regional referral hospital. It means you have time. It buys you time. There's nothing as expensive as time.